Hi, this is Dr. Sam Sunshine. Welcome to our weekly Facebook Live. So I want to welcome all of you who are tuning in and listening to me today. Today I'm talking about air quality. And for those of you who are living in Orange County at this time, we're half a week away from the elections. We've had some pretty significant fires here in the Silverado Canyon. It's very close to our office here in Foothill Ranch. We've had some mandatory evacuations, and the air quality has been very poor. So I thought I'd just talk a little bit about that as a physician. It's important that we educate our patients about the importance of air pollution, air quality, how to assess air quality, remind people that if you are at risk to air pollution with having underlying chronic illness like heart disease, lung issues such as asthma, which I'll talk about a little bit more, just being elderly, that air pollution is a risk. And I'll be talking about the different types of air pollution that is easily seen online and obviously seen in the air. On Monday and Tuesday this week, it was very hard to breathe if you were outside. And I know for me, just my eyes would burn and I'd cough just by walking to my car. So surprisingly, I'd see droves of people still exercising, and we do know that exercise is not good. There are untoward health risks exercising when there's bad air pollution. And I think it's important that people realize that there's three barriers that we have to pollutants and toxins. One is our skin. The other one is our gastrointestinal tract, and the third one is our lungs. And it is a very complex immune system that lines the inner epithelium of our lungs to keep particles, dust, sand, pathogens, toxins out of our bloodstream. So that's what I'm going to talk about today. If you have any questions or you'd like to just share that you're on the call with me, that would be great. You can just put your name in the comment box. If you have some questions, please put those down as well. So the impact of outdoor air quality on respiratory and cardiovascular health is well established. Exposure to air pollution affects asthma, school absences because of asthma, emergency department visits, and hospital admissions for respiratory and cardiovascular disease, and cardiopulmonary mortality. So again, we do see an increased risk of not only asthma exacerbations, but heart attacks. So people have cardiovascular disease, air pollution, or being exposed to bad air quality increases your risk of having a heart attack. So be aware of that. Information about air quality and its associated health risks is communicated to the public using air quality alerts. So I don't think I did get our air quality alert, but some people were receiving air quality alerts on their phones. The U.S. Environmental Protection Agency, or the EPA, designed this air quality index chart. And generally, if it's above 100, you should not be outdoors, nor should you be exercising, and more importantly, you should not be exercising. So I'll talk a little bit about that. So really, what is air quality index? But it's a 6-category index that uses daily and local measurements of air pollutants to identify air quality conditions that range from good, when air quality poses little or no health risk, to hazardous, when air quality is likely to cause serious health effects. Again, be aware of this. I don't know how firefighters do it. I mean, literally just walking to my car, walking outside with the air filled of ash and smoke. It was very hard to breathe. I don't know how they do it. I know they use respirators, but still, my hat's off to any firefighter. So air quality index alerts, such as the Air Quality Index, or AQI, are used to inform the public when air quality is likely to affect sensitive populations, including people with lung and heart disease. Every day, the air quality index tells you how clean and polluted the outdoor air is, along with associated negative health effects that may be a concern. In some mice studies, they were showing how it decreases hippocampal cell apoptosis, or the cell death in the hippocampus, which is used for memory, and also reduces IGF-1 levels, which is a protein made by the liver in response to growth hormone secretion. So the EPA started this AQI, or this quality index, back in 1976, and it runs from anywhere from a 0 to a 500. The higher the AQI, the greater the level of air pollution and the greater the health concern. For example, the AQI value of 50 or below represents good quality, while the AQI over 300 represents hazardous air quality. And I would even say even air quality over 100, I would not recommend exercising outside. For each pollutant, an air quality index value of 100 generally corresponds to an ambient air concentration equals the level of short-term national ambient air quality standard for protection of public health. And AQI values below 100 are generally thought to be satisfactory. And whether these AQI values are above 100, air quality is unhealthy, and at first for certain sensitive groups like asthmatics, people with underlying cardiopulmonary disease like COPD, smokers with emphysema, people with congestive heart failure and underlying heart disease need to be very aware of the air quality index. The air quality index is color-coded, so it's very easy to see. Green is 0 to 50. There's a yellow color for 50 to 100. The orange is 100 to 150. And again, this is members of sensitive groups like asthmatics, like I just mentioned. Those people really need to be careful to be outside and not be exposed to that air quality. And again, it may dissipate. Now we're at Thursday, and a lot of the air quality has significantly improved, so sometimes it's just a few days. Earlier this year, in the summer, we had some significant smoke from fires, and it lingered for quite some time, for about a week, where the air quality was really bad. Again, still saw droves of people exercising outside. It really concerned me, and I think they are putting themselves at risk. The red zone is unhealthy. That's 150 to 200. Purple is 200 to 300, and again, this maroon is hazardous, and that's anything over 300. So again, this is easily found online. You can go to airnow.com, AIRNOW, and you can find the air quality. There's probably an app, I haven't looked at it, but you can see what the air quality is by looking at your phone. Again, green is go, yellow's probably okay. But if you get into orange, if you're at risk, do not go outside, do not exercise outside specifically. There are 5 major pollutants that we see. The one I'm going to primarily focus on is the fire smoke, which we really look at as particulate matter, and it's small particulate matter, like less than 2.5 microns. The higher particulate matter is usually like sand and dust, but some of these smaller particles can get into our bloodstream through our lungs and can be very dangerous. The EPA has established AQI for the 5 major pollutants. Again, one is ozone, the other one is particulate matter, or particle matter, also known as particulate matter. And there's PM 2.5, which is the very small particles, and then there's a PM of 10, which again is the larger molecules. Carbon monoxide is another air quality measure. Sulfur dioxide and nitrogen dioxide. Again, we're not going to be paying too much attention mostly to this particulate matter 2.5. And again, as I stated earlier, the AQI, or the U.S. Air Quality Index, is EPA's tool for communicating daily air quality to the population. And it uses this color coding, which makes it very easy to understand. And the EPA has issued a national index for air quality since 1976, as I mentioned. They did update this in 1999. And it's been updated several times since to reflect the latest health-based air quality standards. In the United States, air quality index for 5 major pollutants that I measured are regulated by the Clean Air Act. So again, I know the ozone level has greatly reduced with the use of catalytic converters and car emission standards. Okay, so most of these particulate matter particles form in the atmosphere as a result of chemical reactions between pollutants. And again, I'm going to be primarily talking about fire and smoke. And these particulate matter stands for particulate matter, also causes particle pollution. And the term for this mixture of solid particles and liquid droplets found in the air. And some particles such as dust, dirt, soil, and smoke are the large or dark enough to be seen with the naked eye. Others are small that they can only be detected using an electron microscope. These particles come in many sizes, as I mentioned, and shapes, and can be made up of hundreds of different chemicals, which is probably what the fires are, because everything burns and it gets into the air. Let me scroll down a little bit. Particulate matter contains microscopic solids and liquid droplets, as I mentioned, and they can be inhaled, of course, and cause serious health problems, especially these particles that are less than 10 micrometers in diameter. Again, we're talking really small things. These fine particles are also the main cause of reduced visibility, or what we know as haze, in the air and in parts of the United States, including many of the treasured national parks and wilderness areas. Again, the EPA does regulate these inhalable particles. The particles of sand and large dust, which are larger than 10 micrometers, are not regulated by the EPA. It's only the smaller ones because those are the more hazardous. So exposure to such particles can affect your lungs and your heart. Most people would say, yeah, I understand it can affect my lungs because I'm breathing the stuff in. But what people don't realize, it can also affect your heart. We do see premature death in people with heart and lung disease as a result of exposure to this small particulate matter. Non-fatal heart attacks. People can develop irregular heartbeats. It can aggravate asthma, which is a reactive airway disease. And it can decrease your lung function. I certainly know there's no way I'm going to run in this stuff because I can't go very far before I have to catch my breath and start coughing. It can increase respiratory symptoms, and it can irritate your airways, causing coughing and difficulty breathing. So again, heed the warning. Don't go out and run when there's a fire locally, even though you're on a training schedule or you're trying to keep up with your doctor's recommendations. Not a good idea. Exercising indoors is fine. So don't get me wrong. It's exercising where there's high air pollution. You want to stay away from that. But people with heart disease, lung disease, children, and older adults are the most likely to be affected by particle pollution exposure. And there are more than 4,000 deaths due to asthma each year in the United States, many of which are avoidable. And I have seen this happen in the ER on more than one occasion, where someone comes in and they've been using their inhaler every 30 minutes for a day and finally come in and they go into cardiac arrest because they waited too long to come in and see the doctor or come into the emergency room. So if you are having difficulty breathing, you need to go in the emergency room to get checked out. And that's something you want to play around with, of course. And asthma is also has been indicated as a contributing factor to 7,000 additional deaths per year in the United States. The rates of asthma have decreased from 15 per 1 million in the population in 2001 to 10 per 1 million people in the United States in 2016. And I think a lot of this, again, when I was growing up, we would have days where we wouldn't go to school because the air quality was so poor. And that was 50 plus years ago. We don't have that as much anymore. Again, it's mostly when we see high fire or smoke from fires. But back then, I think before they had a lot of the emissions from cars were not regulated, we would have bad pollution days where we would stay home from school. So again, the important thing is to limit your exposure to smoke, especially if you're susceptible. The current air quality is the most recent air quality in your area. It's updated hourly. Check your current air quality to see how good it is, if it's a good time for you to go outside. So again, that does change. Just because it's bad air quality in the morning doesn't mean it's going to be bad air quality in the evening. So you can, if you're someone who has some flexibility in your time where you can work out, you might just avoid it at that time, and then if you check again later in the day and the air quality seems to improve, which we've seen from just one day to the next, then it's okay to exercise outside. So again, if you do want to exercise, consider moving physical activities indoors, especially if this is a school. Again, right now schools, I think some of the children are going back to schools. I know most colleges and high schools are still home learning until next year. Reduce your exposure by choosing less strenuous activities for shorter amounts of time. And just some evidence for the health effects of pollution on lung and heart health has really expanded quite a bit over the last decade. There's been a lot more interest, again, in part because of our climate change and global warming that's going on. I think in the future we're going to see probably more days with poor air quality as a result of fires. So we'll see. Short-term health effects are generally similar to that of particulate matter from other sources, such as emissions from cars, industry, buildings, trucks, and buses. But this particulate matter, regardless of the source, drives a range of pathophysiologic responses, including promotion of inflammation, increased coagulation, which is making your platelets more sticky. It creates oxidative stress in our body, and it reduces our endothelial function, which is the lining of our arteries. And we want to keep that endothelial functioning as best we can. Again, respiratory conditions, especially asthma, worsen with increasing concentrations of smoke-derived particulate matter, even at relatively low concentrations. So be aware of that. So again, if you're listening in, it'd be great to have you just type in your name and where you're from, and if you have any questions, please let me know. Again, we're talking about air quality. My emphasis is to remind people to check air quality online by going to airnow.com, and you can get hourly updates as to the air quality, and if it's over 100, I would not recommend exercising outdoors. And that includes swimming. Again, a lot of that particulate matter, especially from fires, just sits on the surface of the water, and as we breathe in swimming, we breathe in the air that's just right on the surface. And some of the studies out of England have shown that swimming actually increases risk of asthma significantly because people are breathing in all the pollutants off the surface of the water. And it wasn't too long ago we used to think swimming was very advantageous for asthmatics. Now studies have shown that it worsens asthma because of the inhaled pollutants from the surface of the water. So again, according to the CDC and prevention, 1 in 13 people in the U.S. have asthma, and more than 25 million Americans have asthma. Again, about 7% of adults. If you are somebody who has asthma and you know that we're having a fire and you're susceptible, it's recommended that you start your preventive inhaler. That's similar like Floban or Advair, usually a steroid-containing. Wixela is another new one that supplanted the use of Advair. Same ingredients. But this is a combination of a long-acting beta agonist with a steroid. But you should start using that at a regular interval to prevent any acute asthma exacerbation, which could be, again, potentially fatal. And I think it's important for the physicians to communicate with their asthmatics. And that's what I'm hoping to do today. So hopefully all my asthmatic patients are listening to this or at some point in the near future pay attention to this talk about air quality. I think it would be very helpful. One of the other things that I ran out and got on Monday was an air purifier. And air purifiers can be very effective in taking out these small particles or particulate matter. I happened to go to Home Depot and they had a huge surplus of these Honeywell air purifiers, and it has a HEPA filter in it, and that's kind of what you're looking for. They do attract the dust particles, dust mites, pollen, pet dander mold, mildew, and volatile organic compounds in these box. And the way that air purifiers work is they just suck in the air, and they have filters in there that trap these particles, and then they blow out air out the other side. It's pure, or more pure. And I've also ordered a couple more for my office. I decided to get the Air Doctor air purifier. Air purifiers usually range from $250 to $300. They're quite expensive. These are smaller ones that usually are good for about 500 square feet. When I was at Home Depot, there was a guy buying 9 because I think he had a large office of 20,000 square feet. So he was buying 9 of these air purifiers. For a few years, I think 4 years or so, we've had one of these kind of more of an industrial size IQ Air. It's a medical grade air purifier that we've had, and I find that that's very helpful to trap germs and to improve air quality. So those are things to think about as getting an air purifier. I know for me at home, on Monday when the smoke had really started in earnest with the high winds, it was hard to sleep because my eyes were burning and it was hard to take a deep breath, and I can smell the smoke in the bedroom. And so with the use of the air purifier, it took that smell away and the burning sensation in my eyes. So something to think about. They're still available at the Home Depot here in Foothill Ranch. And something to think something to have, because again, I think these fires are imminent, and it's not a matter of if, it's just a matter of when. And I know November is always a potentially bad month. And I know when I ride my bike through the Santiago Canyon, that brush is just so dry, and it's so susceptible to being ignited. So again, something to think about is buying an air purifier. And again, anything that has a true HEPA filter in it is probably adequate enough to filter most of the large particles. Again, kind of in summary, it's really important to pay attention to these health alerts about air quality and to heed the warnings and not be tough smart or tough stupid and exercise when the air quality is over 100. Again, that's the air quality index that's set up by the EPA, and it is based on the chemicals that they analyze in the air. We do know that informing patients about the health hazards through text messaging does not seem to have a big impact on changing behavior, unfortunately. So we need to do a better job of informing the population, especially those at risk. Again, the asthmatics, people with lung conditions, people with underlying heart conditions, and children, to be aware that there are hazards, health hazards, when you are outside and being exposed to air pollution. So again, my role as a doctor is to advise patients and to minimize air exposure to high levels of air pollution. So I want to thank you again for listening to this podcast on air quality and how you can ascertain information online through airnow.com. There are several other websites. That is the one that's run by the EPA, I believe. And air quality index is something that's updated regularly. So again, if you have any questions about air quality or what you've done yourself to limit air quality, bad air quality, or limit air pollution exposure, I'd love to hear about it. If you're someone who's asthmatic and you want some advice, you have a question, please let me know. If there's no other questions, I'm going to wrap up this Thursday noontime Facebook Live. Again, I'm Dr. Sam Sunshine at OC Sports and Wellness, and our number is 949-460-9111. I would love to hear from you guys. If you have any questions or any feedback about today's Facebook Live. Thank you so much. Really appreciate you listening in.